Hi everybody, welcome to Healthline. I am Gregory Zarian. Thank you for joining us. Okay, spring has sprung. Happy spring, everyone. Spring is the beginning of spring cleaning, getting rid of things that you don't need anymore. Cleaning out things, making room for new things. It's always about letting go of the old, blessing it, saying thank you, and bringing in the new. And along with spring, we're outside more. We're playing in the park, going to the beach, we're with our family and friends. Some of the snow is melted. But with spring upon us, allergies. Are you sneezing? Are your eyes watering? Are you miserable? A lot of my friends have allergies and they hate it. They're like, it's time for doing a neti pot, taking my pill to get rid of my sinus. It's a lot. So since spring has sprung and it's a beautiful time, I decided to share with you all you need to know about getting rid of your allergies, taking care of them, and the best way to do it is to bring in my guest, Dr. Sonal Patel from Glendale Adventist Medical Center. How is that?
That is wonderful.
Spring has sprung.
Yes, it has.
And
well, more like summer with this weather, but.
I know, right?
Yes.
And within everything that I just said, we're so happy about it, but then watery eyes,
yes,
sneezing, itching,
yes,
scratching,
stuffy nose, yes,
stuffy nose.
Yes.
First and foremost, spring sprung, allergies,
yes,
pollen, everything. Why does it all happen so quickly at this time of year, doctor?
Well, there are varied reasons. The pollen counts tend to go higher, especially trees in the springtime.
Because they were dormant?
Yes,
okay,
during the winter or, rainy season. But here in Southern California, our seasons are not so much seasonal like they are in other parts of the country because we have such beautiful weather year-round. But they do tend to see peaks nonetheless.
So what happens then is that because things are dormant,
right,
it's just in once they become...
Yes, they start blooming, the plants start releasing the pollens, and when those people that have allergies breathe in those pollens, their immune system doesn't recognize those pollens, and their body makes a reaction to that, causing them to have the stuffy, sneezy, runny, itchy.
People become miserable.
Yes, they do.
So, doctor, what is an allergy? Let's just start at the very beginning of it.
So just like I was saying, your immune system is overreacting to something in the environment that it shouldn't. So it could be dust, animal dander, pollens, molds, all sorts of things can cause allergies. So your immune system forms what's called an IgE antibody to something it shouldn't. Okay. All of us breathe in pollen and dust. Those of us that don't have allergies, our immune system can recognize that this is pollen, this is dust, and it won't make us have those symptoms. But those people that have allergies, they form this IgE antibody to it, and their immune system then overreacts every time they breathe that in. And sometimes as the season gets longer, it takes less and less amount of pollen or less and less dust or whatever it is that you're allergic to cause that response, and the response gets greater.
And for your friends that become more miserable, you want to give them a Benadryl and just say, can you relax?
Yes.
Yes, sneeze in the corner and relax.
Yes.
And I didn't do it.
Yes, you do wish you could say that, but sometimes that's not helpful to them.
Because it's debilitating.
Yes, it is. People with allergies, many studies show that they don't actually sleep well at night. Because imagine if you had a cold, and imagine you go to bed with a cold, with a stuffy, runny nose, you can't sleep very well, right? You're not restful, you wake up in the morning, you're not as productive at school or as work, so allergies have a significant impact.
Thank you, doctor. Okay, more with Dr. Patel when we come back in. Between now and then, take a deep breath in and breathe out. Have a glass of water, do some stretching. We'll see you on the other side. Don't go away. Welcome back to Healthline. I am Gregory Zarian. So did you do what I invited you to do? Take a deep breath in and a deep breath out. And in the process of all of that, since spring is here, are your eyes watering? Is your nose runny? And do you hate me because I asked you to take a deep breath in? Spring is sprung and allergy season is upon us. I'm sure you have lots of questions, and I'm here to give you the answers. So joining us from Glendale Adventist Medical Center is Dr. Sonal Patel. Doctor,
yes,
again, spring has sprung,
yes,
and you are my expert.
Thank you.
And I already love you.
Thank you. I'm happy to be here.
I'm so happy to be and you have twins.
I do.
And I'm a twin.
That's wonderful.
It's twin love.
Yes, we can have a whole talk on that.
Next time on twins.
There you go.
And then we'll put my twin over there and your twins over there.
They would love it.
And then we can watch them fight it out. Before we talk more about your specialty,
Yes.
allergies and immunology,
Yes.
what is your medical background?
So I am an Angelino, born and raised here.
Okay.
I went to UCLA for undergrad where I studied biology. Then I went to St. Martin at American University of the Caribbean. Came back to Los Angeles. I did a pediatric residency training through Charles Drew University at MLK Medical Center in Los Angeles. Then I went back to UCLA to do an allergy and immunology fellowship. And I've been practicing for 10 years. I've been part of the Adventist Health family for 10 years.
And what I love about Adventist Health is it's blue zone living. It's the healthiest
It is.
way to
It
live.
really
it's,
is.
it's God, it's whole person care,
Yes.
it's family, it's eating healthy, and
They promote the whole package.
they do.
Yes.
So if, as a country, if we can just promote a whole package of just health and wellness,
Yes.
you know, because if you feel better, you act better, you think better,
Yes.
you just behave in a very different way.
You do.
Spring has sprung, and people have allergies, and they're miserable.
Yes, they are.
So once again, if you're miserable, do not leave.
Yes.
Influx of pollen, influx of everything. You made a comment before the break about things that our body overreacts to.
Yes.
Let's start at the basics. So, are we born with allergies, or are they hereditary?
They can be. There's
Okay.
a strong genetic component. So what we think is it's a combination of having certain genetics and certain things that are a stimulus in your environment, and that combination of that genetics and that environment's poof, and you have allergies.
Okay,
And
so
there
then-
are some people born with allergies.
Okay,
That is
so-
correct, and some develop them later in life.
So they can show up, but can you be born with certain allergies?
You can. There are actually studies where they've looked at cord blood,
Okay.
and there are children that form IgE, that antibody that I spoke of, to various things in utero.
Can you repeat again what the IgE is?
IgE is your allergic antibody, so it's our body's that over response to something it shouldn't be producing to. So you might, if you're allergic to grass pollen, you produce IgE to grass pollen.
Okay.
If you're allergic to dust, you produce IgE to the dust.
And what's fascinating about this is being an identical twin, I got all the allergies. So I used to, years ago, I remember going and getting the little shots in the arm.
Yes, you did.
And,
That's-
and having
I mean,
them
not that it's
numbered.
wonderful that you had to have that, but did it help?
It did. Well, it's interesting is because I was allergic to goose feathers.
Okay.
I was allergic to certain types of food, allergic
Okay.
to wool, cashmere, which makes me very sad. As I got older, I can wear wool, I can wear cashmere. Goose feathers, depending on what it is, and no foods or anything like that, but my twin allergic to nothing.
It's interesting
So-
how that works, isn't it?
So
Yes.
it just happens.
Yes.
So then for like my nephew has allergies, my
Okay.
godson has allergies,
Okay.
8 and 10, can they grow out of them?
They might grow. Certain allergies you do outgrow. For example, young children that are allergic to certain foods. So
Okay.
80% of children that are allergic to milk, egg, wheat, or soy usually outgrow that with
Okay.
age. So by the time they're 5 or 6, and sometimes by their teenage years. If you have a peanut, nut, or fish or seafood allergy, less likely to outgrow that. But allergies do vary with time.
You know, I wanted to address this later on, but I'll ask about it now. Such conversation about peanuts.
Yes.
Like, you know, you get on that great Southwest flight,
Right.
and nothing better than Southwest peanuts.
Yeah, no more peanuts.
No more peanuts.
Pretzels.
Pretzel. And the same thing with gluten and wheat. And why is there such an influx of, let's start with peanuts.
Right.
Why
So
and how?
there's a very interesting theory. It's called the hygiene hypothesis as to why people are developing more
Okay.
allergies right now.
We were addressing a little bit of that
Yes,
before we
and
started.
so you know, you have to have a certain amount of cells that develop in your immune system, what we call Th1 and Th2 type of cells, and you'd like a balance between those cells. And Th2 cells are your allergic cells. Th1 cells are promoted by things like natural infections or endotoxins. And so,
And
if
what
you-
are the, by the way? give me an
So, for example, those that live in more rural areas or that grow up on farms are less likely to develop allergies
Okay.
because they're exposed to animals and all sorts of other things that we city folk are not exposed to.
I know.
So, in the hygiene hypothesis, if you look at rural countries, the incidence of asthma and allergies is much less than it is here in the United States. Here in the United States, we're sort of a very antibacterial society. You know, we have clean drinking water when in city folk are not exposed to endotoxins. So our Th1 arm doesn't develop as strongly, so our Th2 arms of immune cells starts to take over, and hence why we're having more asthma and allergies.
And does that contribute to the peanut?
That is
allergies?
part of the thing of peanuts. Part of it has to do with the way foods are processed. And actually, for a while, it was the consensus of telling people to avoid certain allergenic foods until later in life. And actually, the newer data, which was just published in 2016 in the New England Journal of Medicine, showed that we should be exposing to children to these foods earlier on in life. And if they're exposed earlier, they may not develop the allergies. So it's very interesting. Food allergies is a whole topic in and of itself.
No, because I have a question. Okay,
Yes.
so here's the thing. If you're not allergic to peanuts, please enjoy. If you are, have a pretzel. More Dr. Patel when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. The entire conversation today is all about allergies and what you're allergic to. Are you born with them? Are you not? Joining us is Dr. Sonal Patel from Glendale Adventist Medical Center. Doctor, we were addressing a little bit about why you can't have peanuts on airplanes and the huge conversation of wheat and gluten and all of that. So if I can be clear, with all the antibacterial this,
Right.
wipes and soaps and
Yes.
and gels, have we created too much of a healthy living where our body doesn't fight, which creates more allergies?
That's what the hygiene hypothesis proposes. Yes, yeah, which is hard, you know.
Because you want your child or you want us all to be healthy.
Right. We want
but
you to
we're
be
not
healthy. We
having
want
our
you to
body-
be safe. But it's just our body's response, our immune system's response to these changes that it's
So then,
not used to.
did we create the allergy to peanuts?
That's a difficult question, Gregory. Yes, I don't want to put, you know, to say that, but I think it's just the circumstance
Okay.
is in which the way food processing has developed, in which the way the environment has developed. So it's a consequence.
Oh, okay. So then the
Yeah.
same thing with, like, you know, they're used to. When I was a kid, it was, and there was this great thing I saw on social media about, you know, years ago, it was kids hugging each other and playing outside and drinking out of the water hose and
Right.
eating
Sharing
an
their
apple,
germs.
sharing.
Yes.
And now the kids are on social media, and it
Yes.
changes. So it's kind of like
Yes.
life is turned into a social experience instead of outside living the experience.
Exactly.
So I'm going to. So are you basically saying, and I'm going to say it, or are you suggesting, per se, live your life?
Yes.
Now, okay, so live your life.
Yes.
Okay, so live your life. So do you then invite people to still use the hand sanitizer and all that?
I think that
Or
we
is there-
don't have to be so overly concerned
Because
about some of these things.
I have friends that won't touch anything.
Y-
I'm like, stop it.
Right, exactly.
Okay.
Exactly. I mean, you know, you have to be smart and you have to be safe. I understand all of those things. But I think we've maybe taken it one step too far.
Well, now it's become this I think, paranoid neuroses.
Yes, exactly. And that's what it doesn't need to be.
Okay. So same thing with wheat and gluten. Because there's this huge thing of, I'm gluten and I'm this.
So that gets to be very complicated. So in my opinion, what an allergy is again that IgE
Yes.
antibody where you produce to that, because that could be tested, and that's
Okay.
what I consider an allergy. Now, everybody else sometimes uses the word allergy a little bit loosely, but there are what we call food intolerances,
Okay.
or food sensitivities, which are not the same in my mind as an allergy. So in my mind, it's more like the peanut allergy,
Okay.
where if you were exposed to a peanut, there's a possibility that you'll swell up, stop breathing, go into anaphylaxis, die. Obviously, you know, those are all bad things.
Okay.
Certain food intolerances or food insensitivities, you're not going to die from eating that food. You may have, you know, upset stomach, diarrhea. It may not sit well with you.
Okay.
But again, that's what I consider an intolerance or a sensitivity versus an allergy. And a true food allergy is what we can test for with our skin testing or our blood testing. Food insensitivities or intolerances, we cannot test for.
So bottom line is some people could just be allergic to peanuts, period.
Yes.
Okay, and how does someone know that they're allergic to something?
So it varies whether we're talking about food allergies or environmental allergies.
Let's go food and then we'll go environment.
Yes, so food allergies, in my mind, again, what the true food allergy is, you'll know within a few minutes or immediately after you eating the food, you'll get itchy mouth, you know, you might break out in hives, you might start swelling up, itchy throat, people describe a fuzzy.
Can you break out in a cold sweat too?
You might see that if it gets really bad, if
Okay.
they're going to go into what's called anaphylaxis.
Okay.
But usually itching or some rash is a hallmark feature. Usually what I tell patients is if it's not itching, it's unlikely it's allergic.
Okay.
So.
So just say someone with a food allergy is going through the itching and the scratching. What is your suggestion to them?
So most people with the food allergy that already know that they have a food allergy should carry with them an EpiPen.
Okay.
And so they're supposed to use their EpiPen. Obviously, stop eating the food that you're eating. People sometimes, spit it out, rinse out their mouth. They'll have to inject themselves with the EpiPen. Okay. Then they might have to go to the emergency room. And those are usually
and then also
what
get your family involved.
Yes, yes, and that's a big thing. Having your family and friends involved, school teachers when kids are in school, so that other people know as well too. And then asking a lot of questions, asking what ingredients are in something. The harder part for people is when they're out of their house. In their home, they're safe. They know what's in their food. It's when you're at a restaurant or a birthday party that sometimes you don't know. Or sometimes you'll ask the waiter and they kind of look at you like, oh, no, I don't think there's any peanuts in there, but you really want them to go and check because you want to be safe.
And one thing I want to say too is if you're younger and you want to be cool and you're in high school or junior high or whatever, and you're too embarrassed to ask what's in the food, it's your life you're dealing with, so ask. And maybe even a parent call and go, hey, you know what, Johnny or Susie is allergic to eggs, milk, and raisins. So find out what they are allergic to, share with the parents so they can have something appropriate for you, because it's such a common conversation these days.
It is.
So just say someone has a little bit of itching and still with the food allergy, itching and dry mouth. If they do not know there's a food allergy and maybe that symptom comes up once or twice,
right.
Is that when you invite them to go see an allergist?
That's exactly when I would invite them, yes.
So one time it could just be, oh, maybe they ate something that's not agreeing with them.
Right. Okay. But if it happens a second time around, then we have some consistency here, and it's advisable to get that tested before you're going to want to eat that again, because the reactions could get progressively worse.
Okay, I could talk to you forever, doctor. More on the environment and what you could possibly be allergic to when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. Did you know that Glendale Adventist Medical Center is ranked the 24th best hospital in California? That is out of 347 hospitals, and 13th best hospital in the greater Los Angeles area by the U.S. News and World Report 2016-2017. Joining us from GAMC is Dr. Sonal Patel. Doctor, we were addressing food allergies.
Yes.
If somebody has a food allergy, what is treatment?
Unfortunately, the treatment is don't eat the food you're allergic to.
Okay, really, pretty simple.
That's all that we have to offer, even in the 21st century.
But what's pretty amazing, though, that there's lots of alternatives.
There are.
So if you're allergic to milk per se, right. there's almond milk, there's soy milk, yes. There's all these great alternatives.
Right.
Don't play with your life. People can actually die from allergic reactions.
Yes, unfortunately, there are people that die from allergic reactions, and most of the time it's because they didn't have their injectable epinephrine with them. Okay. Actually, that's the #1 reason why people die from food allergies, because sometimes accidents happen, no matter how careful you are at reading labels or asking questions. An accident happens, but if you have your EpiPen with you and you use it in a timely fashion, you hopefully shouldn't have a bad outcome.
And also inform your employers, inform people you work with, and especially inform your friends and family that this is what you're dealing with, because it's a conversation not just about you, but with your family.
Yes.
Environmental allergies.
Yes.
Pollen.
Dust, cats, dogs, mold.
My pets. I was even reading earlier before I got here, there's latex allergies.
There can
people
be.
are allergic to water.
No, hopefully not yet.
Hopefully not yet. No. But once I did a show on Healthline years ago, and somebody said that people can possibly be allergic to types of water. Is that true?
Not in that IgE-mediated allergy that we talked about. They may have certain conditions where they have, but I wouldn't consider that an allergy. Again, I'm strict in my definition.
And I love that. So someone has an environmental allergy.
Yes.
Signs and symptoms.
What we talked about earlier, stuffy nose, itchy nose, sneezing, post-nasal drip, yeah, scratchy throat. Eyes, your eyes get red, itchy, or watery. And then, of course, your allergies can affect your sinuses as well, too. So sinus headaches, pressure, pain, ear pressure, itching, any of those things. And those that have asthma, it can affect their asthma as well,
So
too.
is asthma considered an allergy?
It's technically not an allergy, but asthma is a respiratory condition. But a strong percentage of people who have asthma have allergies. So there's a very strong allergic component, especially in children who have asthma.
So, and also allergies affect your sleep?
Yes, they don't sleep well at night. Yeah, so there's a lot of what we call absenteeism and presenteeism. So absenteeism is if you didn't sleep well at night, your allergies are bad, your asthma is bad, you can't go to school the next day. If you can't go to school the next day, the parents can't go to work that day as well too. Or presenteeism, what that is you do show up for work or school, but you're not as productive because you're not well rested, because your allergies are making your nose stuffy and your life miserable.
So what is your invitation in regards to treatment for allergies?
Well, I would say the first thing is get yourself tested.
Okay.
Know what you're allergic to.
So that goes back to what I was talking about when I was tested.
Yes, exactly.
Is that still common practice now?
That is exactly what I do in my office every single day, where you get the scratch test done to find out what you're allergic to. What we do is scratch you with the thing that we're trying to find out if you're allergic to, the dust or the grass or the trees or the molds. And if you are allergic, at least that way then you know what to avoid. As much as theoretically possible. Sometimes you can't live in a bubble. You can't avoid everything you're allergic to, or we can't avoid pollens, but things like dust or cats or dogs, that's a little bit more avoidable than maybe the grasses or trees are.
Do people grow out of those?
Environmental allergies are not usually grown out of unless you get the allergy shots like you got. So sometimes they become desensitized to the things that they're allergic to. And
once you look at me and go, yeah, you have the allergy to dust or dogs, then do you give a medication? Do you give?
I do. I tell them 3 options for treatment: avoidance, medications, and shots. So first step is, again, trying to avoid. Second step is medications. Nasal sprays, oral antihistamines like your Claritin or your Benadryl. Benadryl makes people sleepy, so I'm not as fond of it. People can get a hangover effect of that. Nasal sprays, eye drops if you need them. If you have asthma, you'll have to be on an inhaler. So various medications that they need, but sometimes it's hard. People don't want to take medicines. They don't. I found people don't like taking medicines, especially they don't like taking it on a daily basis. So it's difficult.
Do you support holistic remedies along with
medications? In our training, we're not trained on holistic medicines, but in my opinion, allergy shots is sort of like holistic medicine, because what I do with allergy shots is, if I found out that you're allergic to grass and tree pollens, the injections that I'm giving you contain protein from the grass and tree pollens. So in a way, that is like holistic medicines, because I'm trying to desensitize your body to the things that you're allergic to. I'm trying to build your immunity to that so that you won't make that response, that aberrant response that you're responding.
And also it's important to also find out, like talk to your parents about if grandma and grandpa or auntie and uncle had any allergies too, so you can bring into the conversation. So when we come to you as a family, the more information you have, the more you can treat us.
Exactly.
Cigarette smoke, allergies.
Yes.
Give me thoughts on that.
It's awful. Cigarette smoking affects your asthma and your allergies. There's many research studies that prove that. The smoke itself, of course, has particles and toxins. And even if people are smoking, first of all, the patient themselves shouldn't be smoking, but you'd be surprised how many still do. But a lot of times they have family members that are smoking. And even exposure to secondhand smoke can exacerbate your conditions and worsen your problems. So smoking cessation is an absolute must. And I discuss this with all of my patients at every visit. Okay, are you smoking? Do you have smokers in your household? And if they say yes, what can we try to do to help you to stop smoking? Because it's not easy to stop, but it's beneficial to the smoker and to their family.
I smoked 2 packs a day for 20 years, and I had more bronchitis than I can even discuss. Albuterol inhalers were my best friend. And I quit smoking 12 years ago.
Yay.
Doctor, final thought in regards to allergies and wellness.
Allergies are obviously very prevalent, but I think with cooperation, we can get them under better control. And what I tell a lot of my families and a lot of my patients is that my job is to work with you so that you can do all the things that you want to do. I don't believe that somebody with asthma or allergies should have to stay indoors or not be able to, run the mile. I say there are Olympic athletes that have asthma. So if they can do it, we can do it. It's just finding that plan that works for you.
I love you.
Thank you.
So you heard it from Dr. Patel. Have a conversation. Remember, the most important conversation you're going to have is about you and your health. So why not have one now? And please feel free to join us on our social media. Visit our YouTube channel at GAMC Healthline, and also follow us on Facebook at Glendale Adventist, Twitter at GAMC Health, and you can also find us on LinkedIn. I'm Gregory Zarian. Thank you, and don't forget to get your hashtag HealthOn. We'll see you next time.